Hi everyone, this is Dr. Mariana Vergara, and we're here to talk about Upneeq. It's a prescription eye drop medication for low-lying eyelids. Low-lying eyelids is also known as an acquired ptosis. It can affect one or both eyelids. So basically, the eyelid is going to sit in your iris. Not only is going to affect your appearance, it can also impair your vision. Age is a common culprit. As we get older, the muscles are going to start to weaken. They're going to give us this tired look, and Upneeq will be amazing. So basically, it will contract the muscle that elevates the eyelid up to 1 millimeter. This non-surgical eye drop is intended to be used one in each eye, and it will last up to 8 hours, and you can do it daily. So how does Upneeq work? Basically, it's a medication called oxymetazoline. It's going to stimulate the receptor of the mullary muscle. This muscle is going to contract, and it's going to elevate the eyelid. When you use Upneeq, the results are seen after 15 minutes, so it's really fast. So when my patients come to me, they tell me that they feel like they look tired, that they want to look a little bit more awake. That's when we talk about the option of Upneeq. Now, if you have high blood pressure, close angle glaucoma, or any blood thinning disorder, make sure your medical provider approves that Upneeq is right for you. Low-lying eyelids can be a cause of a more severe medical condition. Talk to your medical provider and determine if this is the right option for you. Sometimes surgical will be a definitive correction for this problem, but Upneeq can be applied to improve while you determine if surgery is the right option for you. Most of my patients don't have side effects, but if you experience side effects, the most common are going to be headache, blurry vision, inflammation, or dryness. Wondering if Upneeq is right for you? Talk to your eye doctor, your dermatologist, your medical provider. They will evaluate your condition and they will give you a prescription. And most of the practitioners, like me, we have Upneeq available at the clinic.
Important safety information. What is Upneeq? Upneeq, oxymetazoline, hydrochloride ophthalmic solution, 0.1%, is a prescription eye drop used to treat low-lying lids, acquired blepharoptosis, in adults. What warnings and precautions are associated with Upneeq? Low-lying lids may be related to conditions such as stroke and/or brain aneurysm, Horner syndrome, myasthenia gravis, loss of the ability to move eye muscles, eye infection, and eye tumors. Ask your doctor if you have any of these conditions. Upneeq is a type of medication that may affect your blood pressure. If you have heart disease, uncontrolled high or low blood pressure, or feel faint at rest or when quickly standing up, you should call your doctor if your symptoms get worse. Patients with reduced blood flow to the brain or heart, or patients who experience eye or mouth dryness due to an immune system disorder, Sjogren's syndrome, should use care when taking Upneeq. Call your doctor immediately if you feel your symptoms may be getting worse. Upneeq may increase the risk of eye pressure due to fluid buildup, angle closure glaucoma, in patients with untreated narrow angle glaucoma. Call your doctor immediately if you feel increased pressure in your eye after using Upneeq. Do not let the tip of the Upneeq vial touch your eye or any other surface. This can help prevent eye injury or contamination. Each Upneeq vial is for one-time use and should be discarded after being used. What are the most common side effects of Upneeq? The most common adverse reactions with Upneeq occurring in 1 to 5% of patients were eye inflammation, eye redness, dry eye, blurred vision, eye pain at time of use, eye irritation, and headache. What should my doctor know about before prescribing me Upneeq? Your doctor should review your full medical history before prescribing Upneeq. Upneeq belongs to a class of medication, alpha-adrenergic agonists, that may affect your blood pressure. Use Upneeq carefully if you currently take an alpha-adrenergic antagonist medication to treat heart disease or an enlarged prostate. Patients taking beta blockers or other medications to treat hypertension or an abnormal heartbeat should also be careful when using Upneeq. Patients who use a certain class of antidepressant medication, monoamine oxidase inhibitors, should also be careful when using Upneeq, as it may affect the way your body absorbs the medication. These are not all of the possible side effects of Upneeq. Tell your doctor if you have any side effect that bothers you or does not go away. Call your doctor for medical advice about side effects. To report side effects or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report side effects to the FDA by calling 1-800-FDA-1088 or visit www.fda.gov/medwatch. This document has summarized the most important safety information for Upneeq. For more in-depth safety information, please review the full prescribing information for Upneeq.